You currently feel like your upper back or middle back is rounded forward and you have associated pain and stiffness in that area? If so, there's a good chance you're suffering from a medical condition called hyperkyphosis, which means your spine is bent forward. Hey everyone, welcome back to our channel. My name is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. I'm an evidence-based sports chiropractor, and in today's video we'll be discussing this in fact versus fiction, so you know what you should worry about and what you shouldn't, what it presents like, the best exercise and stretches to help it, and then versus more severe cases, surgery. Using our model here, we're going to kind of help explain what this is and where it affects. So this is the base of your skull called your occiput. And the top 7 bones is called your cervical spine or your neck. The next 12 is your thoracic spine or the mid-back. And then the bottom 5 is your lumbar spine or your low back. Now this condition affects your thoracic spine or the middle part, so T1 to T12. Now when the curve faces this way, the concavity is facing backwards, and that's called a lordotic curve. This thoracic spine, as you can see, the concavity faces forward, and that's called the kyphotic curve. And then the low back or lumbar spine, again, is lordotic. So this curvature naturally bends forward a little bit. But with hyperkyphosis, this curvature becomes excessive. And we're going to talk about that, and that can lead to problems. Now, in the literature, it's hard to define what this exactly means. Some papers say more than 40 degrees, some papers say more than 50 degrees, because everyone has some kyphosis. As you can see here, I myself have some kyphosis, and you got to think of a bell-shaped curve. People come in all shapes and sizes, so some kyphosis, maybe even a little more than average, is okay. It's only at the more extremes, at these 40 to 50 degrees, that becomes problematic. But it will probably get worse with age, so getting these exercises in as early as possible will help prevent it. But I don't want you to think that a little kyphosis is bad. It's like everything else. At some extreme amount, it becomes problematic. For reference, what average kyphotic curve is, in younger adults, it's about 20 to 29 degrees for the Cobb angle. Whereas adults over 65, the ranges are typically 35 to 38. This is one of those medical conditions that have several factors. So the first is as we get older, our spines are going to get a little more curved and our muscles get a little weaker, which is why consistent exercise is so important as it affects both of those. Secondly, they found that people with vertebral stress fractures or fractures in the vertebral bodies, for every one fracture, you probably have an increased curve of 3 to 4 degrees. So making sure that you prevent those, or if you have those, mitigating effects are important. So osteoporosis and osteopenia, conditions where your bones get weaker, is prevalent in this condition. Now here's another link of why lifting weights will help increase the density of your bones through Wolff's law, which basically means that bones adapt to stress placed on them, similar to muscles or tendon. Genetics also plays a role, and about 40–50% of people have some genetic predisposition, especially people that have Scheuermann's disease, which is a condition that affects adolescents. And we'll talk about more specifically later in the video. Also, this can affect physical performance, and the research says that your increased risk for fall is about 2 times with this disease. Now we need to talk about this term called upper cross syndrome. And what this theory proposes is that certain muscles, specifically your traps and pecs, are tight and overactive, and other muscles like your lower traps and rhomboids are weak, and this causes your back to round forward. And if you Google this, there's undoubtedly going to show you that this is the cause, but there's some problems with this theory. So going back, this originally was proposed by Vladimir Janda based off observation, and biologically it makes sense that this would cause it. But there's some problems with this. When we look at studies, there is overactivation of certain muscles. We don't know if this is causing the change or from the change. And these muscles aren't super big, so it's more likely that these are affecting because of the spine changes, not causing the spine changes. So these may play a small role, but the takeaway here I want you to get is that these main drivers are age, genetics, and a decreased strength in your extensor muscles, not a certain tight muscle. So don't spend as much time stretching your pec and strengthening your back to help improve your extension. With this, there's 2 kind of breakdowns. So there's the cosmetic presentation and the medical presentation. What I mean by cosmetic is people don't like to feel slouched forward. They don't want their head to go forward or feeling their shoulders are rounded. And these will all happen as your thoracic spine bends because your shoulder blades are all fixated on that. So the more you round your back, the more that all goes forward. So by increasing your extension of your thoracic spine, that helps. But what people do is they just pull their neck back and push their shoulders. And that may visually look like it corrects it, but you're not actually addressing the problem. You might feel like you have a lack of mobility in that upper back, so reaching overhead can be problematic. When this gets bad, you'll have constant stiffness and pain That's usually worse with standing and walking. And then sometimes you can feel unsteady because as you bend forward more and more, your center of gravity goes forward. And so you might feel like there's an imbalance or you feel like you're going to fall forward. Now, it does seem like increases the risk for falls, but the research kind of depends on that. So it's not 100%, but these things are probably problematic. And it's kind of like a scale. So the farther you bend forward, the worse these are going to get. With posture, I see a lot of people make some silly mistakes. So we're trying to get this upper back to extend more. So when you're sitting or standing and you feel bent forward, don't just arch your low back and push your shoulders, okay? That's not the problem. The problem is your mid-back. So what I want you to think about is when you're sitting or standing, think tall spine, or think there's a thread on your head and it's pulling you up. So as you're sitting or working, you need to get tall and you need to feel tension in the middle of your shoulder blades or your thoracic spine. So don't just, if you start to push your shoulders back or pull your chin back, that's not fixing the problem, and it's probably just going to cause tension in your neck. So small, subtle changes throughout the day can help form good habits. So think either tall spine or there's a thread on your head pulling you up, and I want you to practice this 3 to 5 times a day for 10 seconds initially, working up to 30 seconds. So you start to build that good behavior and that better posture. This, we need to make sure we have precise measurements. So you can't just look at someone and tell how much their kyphotic curve is in their back. You need an x-ray, specifically a Cobb angle x-ray. Now, historically, this was used for scoliosis. So if you look at someone's back, there's a curvature side to side. That's called a scoliosis. Now, this is a profile. So the person's to your side, you take an x-ray, you can see the curvature of their back. And what you do is from T4 to T12, because above T4, the shoulders and other structures kind of obstructed, you're going to draw lines and then you measure an angle from there, as we show you here in this picture. And that will give you definitive angle of your kyphosis or changes to your curve. And this is good for 2 reasons. You can know initially how much curvature you have and also have a baseline. So maybe in a couple of years, you can see if the exercises have improved or if nothing else, prevent it from getting worse. So I highly suggest that if you have this and you haven't got this x-ray, since we all can't just run to the x-ray whenever we want, 2 ways that you can kind of monitor progress of this condition at home is the Occiput-to-Wall. So stand against the wall, put your head against the wall as close as you can, and then find something to measure the distance. If it takes more, it's getting worse. If it takes less, it's getting better. Or the block method. So same thing as but laying on your back, put some blocks between your head and the ground. If it's taking more blocks over time, it's getting worse. If it's taking less blocks, it's getting better. So these are some simple ways to measure progress or regression. We're going to cover the stretches. We're going to give you a bunch of different options. Like all of our videos, try them all and then focus on the 3 or 4 that's most effective. These are dynamic movements, not static holds. So I want you to think about stretching as you move, not just holding as hard as you can at end range. Try to start with easy intensity, then progress to middle intensity, and then more higher intensity. We love RPE, but you can use anything. But start slow and then work up over time. Wall angel. With your heels, your butt, and your back against the wall. Bring your arms up to 90. Keep your wrists as close to the wall as you can. Slide them up and down. Now I can't get all the way back, so I'm just gonna slide my fingers along the wall, but try to get them as far back as you can. Feeling a good stretch in the anterior chest and upper back. Wall stretch. So with your arms at 90 and your elbows straight, we're gonna push our upper back through our arms, keeping pressure into the wall, and then come back. One thing, don't round your head down. You're trying to keep your upper back not rounded, but extended as much as possible. So press in, press through, and then feel tension in your upper spine and middle back. So again, press into the wall, press your shoulders through, keeping your head up. Hold, and then return to the starting position. The next stretch, we're gonna have our arms over our head. Now you can do this in a seated position if you want, but we're gonna lean forward, keep your elbows straight, and I want you to feel a stretch here in your upper back and then that mid spine. So elbows straight. Now maybe bring it down a little bit or go up higher to make it harder, but we're gonna stretch forward, keeping our upper back extended, and try to keep your head looking straight forward. Don't tilt down. We're trying to get that motion here, not in your neck. So elbows straight, bend forward, hold, and then return to the starting position. The seated thoracic extension. So in a seated position, we're gonna place our hands behind our neck, interlocked, keep our elbows in. And what I want you to do is keep your core squeezed because we're trying to lift our elbows up and our neck up, extending our upper back. You don't want to arch your low back. If you feel tension in your low back, you're using the wrong part. So keep your abs squeezed, elbows in, and then just look up to the ceiling. You're not going to move a lot, but if you're doing this right, you're going to feel good extension or tension right between your shoulder blades. So see how I'm just moving a little bit? That's all it's going to be. If you're doing a lot, it's too much low back. So keep the core squeezed, elbows in, and then tilt up. Foam roller extension. Now, some people with a ton of curvature, or if you have osteoporosis, you probably shouldn't do this one. So be careful, or maybe ask a healthcare practitioner before you do it. For those that can do it, we're going to lay with that foam roller on our mid back. Again, keeping our hands to support our neck, elbows in. We're going to think about bending right where the foam roller is, and then come back. Now, one thing I want you to think about with this is don't just let your gravity pull you in. I want you to think about those muscles, those extenders, to actually pull you backwards. So find that spot, elbows in, and then actively pull with your back muscles, keeping your core engaged so your low back is not in. Then you're gonna roll it up a little bit. Same thing, core squeeze so your ribs don't come up, elbows in, and then actively pull down, and then up, actively pull down. But kneeling horizontal cross. So with the outside leg up and the inside leg down, we're gonna have that hip against the wall and our shoulder and our hand against the wall. Put your other hand here and then rotate, following the moving hand with your eyes and your head. Again, I want you to think about that whole concept, and the whole thing is moving as one. So not just your neck, but your upper back, your neck, and your head. Keeping contact with the arm and the shoulder into that wall. Repeat on the opposite side. Arm windmill. So in that same position with our hip and shoulder against the wall, support your outside arm, and we're gonna do a giant half arch all the way back, pause, and then come back. As you're doing this, I want you to think about reaching as high up the arm as you can and try to focus on moving your upper to middle back, not just your arm or your shoulder. Now for exercises. A common myth and a question I get a lot is if I do exercises, is it gonna make my back round more? And the truth is it's not, for two reasons. So one, these muscles along your back are extenders and they actually lift your spine backwards. So as these muscles get stronger and better endurance, they're gonna naturally hold you upright. Secondly, as you exercise, the bones are gonna get more dense, like that video we talked about. And what happens with this is the anterior part typically collapses more than the back. So as you put more stress into that bone, it's gonna get denser, helping it stay more upright. So exercises are really important for both strengthening the muscle and strengthening the bone. Before we start, again, we're going to give you a bunch of different options. Do 3 to 5 that you think are the best, and then gradually progress. We like RPE in terms of how intense. So when you start, your intensity needs to be easy, 1 to 3 out of 10. You can't go too quick with these or it's just going to cause more pain and dysfunction. So it's all about the right dose. So we highly recommend that you start with easy, and after a while go to moderate, and then eventually go to hard. But you have to progress as your symptoms and tolerance allow. You can't just go from 0 to 100. It's not going to go well. So use that scale if it helps to kind of calculate how intense you should start and make sure it's easy. Foam roller arm reach. So with your spine hot dog along the spine, so your spine is running parallel to the foam roller, with your knees bent, we're going to reach one arm over our head towards the floor, elbow straight, and then the other. And what they find is as you flex your shoulder or you raise your arm overhead, it helps automatically extend your upper back or your thoracic spine. So this shoulder motion is actually going to help your back into the position that we want. Now, when you do this, I want you to keep your core engaged so your back is not rounding in your low back, but drive your arm as low as you can comfortably to the floor. The bird dog hold. So on your hands and knees, we're going to straighten one arm and the opposite leg, hold for 3 seconds, and then repeat. Now this initially is a pretty low load muscle activation. So we want to increase intensity as quickly as possible. So after you do this a few times at 3 seconds, if it's tolerable, I want you to hold for 5 seconds. Now after you do this a few times, what I want you to do is get a light weight and an ankle weight and do it on your hands and ankle like this to make it more challenging. Prone hip extension, laying face down, with our legs straight. We're going to lift up, pause, 1, 2, and then repeat on the opposite side. You want to feel tension in your glutes and hamstrings as well as your back. Make sure to pause at the top and make sure you get the muscle activation in your low back and middle back. Face down cobra. Laying face down, we're going to lift up our torso with our mid and upper back, pause, and then return to the starting position. Again, you can lift up with your middle to low back, and then return to the starting position. To make it more challenging, we can put our hands on our head, lift up, pause, and then return to the starting position. Sideline lateral leg raise. So laying on our side with our hip and back and heel against the wall, we're going to raise our leg up, pause, and then return to the starting position. Again, we're going to raise our leg up, pause, and then return to the starting position. If it's too hard to lay on the floor, you can do this in a standing version as we demonstrate here. Kneeling banded rotation. So in that same kneeling position with our leg against the wall and our arm against the wall, we're going to grab a light band and rotate through our upper back as far as we can, and then return to the starting position. Make sure to follow your moving hand with your head and focus on that part of your spine between your shoulder blades. Supine leg raise. So laying on your back, we're going to bend one knee, keep the other knee straight and extended with our foot neutral. We're going to lift our leg all the way up, feel a tension in the front and a stretch in the back, and then come back down. Okay, we're going to lift our leg all the way up, pause, and then return to the starting position. So we talked about how raising your shoulder up or flexing can help extend your upper back and mid back. So we're going to hold a light weight and we're going to do a J motion. Now again, I want you to keep your core engaged so you're not arching your low back, but think about just a J. So as I press up and out, I feel a lot of tension in my upper and middle back between my shoulder blades, and then it goes away. So core engaged, press up and out, feel tension, pause, and then return to the starting position. Bringing the foam roller back, we're going to work on that extension after we have it built in with some weight to activate the muscles. So putting a light weight behind your head, we're going to extend through that foam roller like we did earlier, but that weight's going to give you some exercise to strengthen those thoracic muscles and those paraspinal muscles. Make sure to keep your core engaged so it's not your low back, and then adjust the weight to your current tolerance, but this is going to be a really good exercise to help build strength as well as improve mobility. A box squat. We like this initially because it gives you a sense of stability behind you. So in a comfortable stance with a weight over our midfoot, we're going to press our arms out, sit down, loading our hips, and then stand up. Make sure using your hips and your legs. Don't lean forward and lift with your back or push your butt out. Just kind of sit back, load your legs, and then come up. As you get more comfortable with this, I want you to add a light weight and turn it into a goblet squat as we demonstrate here. If it's a little too challenging, you can do a wall squat here initially and then progress to the goblet squat. Another good exercise is a suitcase carry. So with a light to middle weight or a bucket or a book or something against the wall for stability in case you need it, I want you to walk and carry that weight. Keeping upright as much as you can and prevent going down. If you feel at any point you need the wall to stabilize yourself, that's fine. Lastly, we're going to cover a lightweight deadlift. Now, if you don't feel comfortable with this, that's fine, but if you do, it's a really good exercise. And for the purpose of strengthening your upper to middle back, what we're going to do is with the light weight, as you go down, we're going to go slow tempo and kind of swing it away from you a little bit, because as you swing it away, you're going to feel more tension in your upper to middle back, which is the intention of this exercise. Now, don't worry, bending forward is not going to round your back permanently. We're strengthening these muscles, and those are naturally going to keep you extended. So this is a really good exercise. So with that light weight, push your hips back, swing the weight forward a little bit, and then come back. Again, this is not for everybody, and make sure you feel comfortable with the deadlift before you do it, but bend down, swing them out a little bit, and then come back to forward. If you feel at all you're going to fall, don't do this exercise. For bracing, there are different types of braces. There's a Milwaukee brace, the kypho brace, the Charleston bending brace, and the thoracolumbar-sacroiliac, also known as the TLSO. These braces, overall, the research is pretty low quality, but I did find this one randomized controlled trial for a semi-rigid brace that found that people that wore it 3 to 4 hours a day for a few months, about 3, did seem an increase in spine curvature and a decrease in symptoms. Now the thing with this is adherence. This 3 to 4 hours a day is actually a lot for that long. So sometimes people just aren't willing to do it. Now you have to kind of temper your expectations with these braces, but it does appear that it's worth at least trying. Early in the video, we talked about Scheuermann's disease, and we do a little deeper dive. Now this affects adolescents, typically young males, and there's a large genetic predisposition. About 50% of this is caused by genetics. Now one thing with younger people is your bones don't fully form or reach scale maturity until about 25 years old. So if you can catch this when the kid is 14 or 15, raises and exercises have a better chance of actually reversing that curve because your bones have some give. Once you get old and they're fully fused, it's a lot harder. So early detection and intervention is a key. So there's some braces that we'll talk about later, some taping, and then some light soft tissue. But again, trying to identify this early and getting your kids treatment fast is paramount. Hands-on care like soft tissue, joint mobilization, or adjustments, it may be helpful in reducing some symptoms, but it has to be adjunct with the exercises. You can't just do these alone. They may help reduce your pain or tightness, but it's not going to increase the curvature of your spine or strengthen the muscles. Now, anyone with osteoporosis or the elderly cannot have adjustments. They're contraindicated. So this really becomes down to a skilled clinician, not just a hammer and every problem's a nail. So I'd be very careful letting people push on your back really hard if you know you shouldn't. But it may help reduce your symptoms in the short term, but you're not going to improve the function without the exercises. Now let's look at the more adverse effects that there's research to support this. So first, physical performance. It seems that it's questionable at this time if it decreases physical performance. Some literature says it does, some says it doesn't. With mortality rates, it does appear that mortality rates increase when you have a kyphotic angle, also with osteoporosis. But that may be more due to osteoporosis than the kyphotic angle, so more research is needed. Fractures. Changes to the kyphotic angle do not appear to be associated with an increased risk. Next is pulmonary function. This is one thing that I was surprised with. With this increased kyphosis up to 40 to 50 degrees, it does not appear to decrease pulmonary function. Lastly, we'll talk about surgery. Now, this will be a brief overview, and you should always talk to a surgeon, but I want to make this be a little more informed conversation so you have a better understanding of this. So first, there's 4 kinds of surgeries. There's spinal fusion surgery of the posterior part. There's an anterior fusion. There's a vertebral column resection. And then there's lastly an osteotomy, which is a Smith-Peterson. For instance, this paper comparing surgery versus non-surgical treatment found that after 2-year outcomes, the people that had surgery had improved radiographic measurements and quality of life, while the people that had non-operative care had no deterioration. So at least they were no better off after 2 years. Now with surgery, there's always inherent adverse effects and complications. So you want to make sure that you talk to your surgeon about that. But it does appear that surgery can be helpful in improving both quality of life and spine curvature.